Hello my dear students, I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today, I'm starting my series on femur. So let's begin. Remember, throughout my teaching session, I always ask a lot of questions, okay? All answers to my questions are either in the lecture itself or they're there in the notes section. Okay, but ensure that you know the answers to those questions. Again, read this instruction very carefully, okay? So, you have to sit for femur, which is a bone, with the bone. It can be an original bone, it can be an artificial bone, doesn't matter. But have the bone with you. In fact, you should also have the hip bone and the tibia and the patella of the same side. So, as and when we are doing our discussion, we can do the articulation, right? Okay, so how are we going to go about this? I'm going to teach you all these things, introduce the bone, show you the location, help you to understand its functions and so on. But I will be doing this in the form of lecture 1 and lecture 2. So there will be 2 lectures on femur. In the first one, I'm going to focus on the upper end and of course in the side identification, normal anatomical position and so on. By the time you come to the lecture 2, you should be ready to understand additional details of femur. Right. Throughout the lecture, try and answer my questions. Otherwise, go to the notes section and find out the answers. Do not move forward without learning the answers to the questions asked. Okay? Right. Ready? Okay. So, what is femur? Where is femur? Question number 1. So, you can see that this is your femur. That is your femur, all these. The bone of your thigh is the femur. So what functions does it perform? You will say, ma'am, it's such a basic question. Of course it's basic. But let's get our basics clear. So it's important in weight bearing. It's important in your movement. Can you imagine trying to walk without moving your thigh? I doubt if you can even imagine something like this. Then it supports and helps to maintain your body's balance, stability, isn't it? And finally, surprisingly, it's responsible for hematopoiesis. It helps you to produce your RBCs, especially in your childhood, okay, when in your intrauterine life. So all these are the basic functions. There are many more, but that's not what this lecture is all about. So joints formed by femur. Now don't bother to look at the screen. Think, femur forms how many joints? At the upper end, it articulates with the acetabulum, forms the hip joint. At the lower end, it articulates with the tibia, forms the knee joint. And of course, it also forms a joint with the patella. So many times, it's nice to, think for yourself. Don't expect everything to be taught because then you don't realize that there's quite a bit of knowledge you already carry with you. So it's always good when I ask you a question, what are the joints formed? You answer without having to look at a book. Right. So this is the hip joint, this is the knee joint. And you can also see the patella articulation there. Right. So let's talk about the femur. Femur is a long bone. Femur is the bone of the thigh. It's the strongest and longest bone of the body. And it has an upper end, a lower end and a shaft. Yes, it has an upper end, a lower end and a shaft. Clear? Right. So now what we're going to do is we're going to pick up the femur, understand bits of the femur on the bone. But before that, let me quickly run through. And remember, I'm not going to give you details in this initial section. Just enough details will be given to you to help you to identify the side and to hold the bone in its normal anatomical position. And then as we go further, I will keep on teaching you the details again and again till you know the bone in and out. Right? Okay, so come to the screen now. This is the head of femur. These are the 2 condyles. Okay, so at the upper end you have a head, at the lower end you have 2 condyles. This is the greater trochanter, this is the lesser trochanter. And this posteriorly is the linea aspera. Now you must be thinking, without the bone, ma'am, it's really difficult to understand. That was the point I was making. It's only with a bone that you can actually understand a bone. You cannot imagine a bone on paper, right? So come on, pick up the femurs and I'm going to pick up mine and let's study on the bone. Ready? come. So right, now let's come to the bone. Please take the bones in your hand, individual bone of femur, and now let's look at this bone. This is the head which is to be placed superiorly. These are the two condyles, the medial and the lateral condyles. This here is the greater trochanter. Can you see how large it is? And this here is the lesser trochanter. Okay? And now let's turn the bone a little and look at the bone from the side. Can you see that this bone is anteriorly convex? There's a clear convexity here. This is anterior, should be placed anterior. Now turn it around and posteriorly you find a clear roughening. Okay, you will feel the roughness. This roughening is called linea aspera. What is it called? Linea aspera. And this must be posteriorly, along with a little notch between the two condyles. Can you see that between the medial and the lateral condyle there is a gap? This is called intercondylar notch. Okay, let's revise this. This is the head of femur, superior. These are the medial and lateral condyles, inferior. This is the greater trochanter, laterally. This is the lesser trochanter, medially. This is the smooth convexity. Again, see how smooth it is. Smooth convexity anteriorly, and this is the rough linea aspera posteriorly. Carry it down till you can see that there is a little gap between the two condyles, intercondylar notch. So linea aspera and intercondylar notch must be posterior, right? So hold the bone keeping all these correctly. Superior, inferior, lateral, medial, anterior, posterior. Okay, and then let's come back to the screen now. Have you got the basic 6 to 7 features of femur? Okay, then if you've got it, come back to the screen. Let's continue. So having understood the femur, the basic 7 features of femur, let's use them to hold the bone in its normal anatomical position. So now, put the head superiorly, put the condyles inferiorly, put the greater trochanter laterally, put the head and lesser trochanter medially. Now put the linea aspera and intercondylar notch posteriorly and put the convex surface anteriorly. Now students, be careful. How do you hold the bone in its normal anatomical position? Okay, so now rest the condyles on your horizontal surface and you will find the bone automatically goes to its normal anatomical position. Okay, I'm going to show it to you here. So now take the bone and rest it on a horizontal surface so that both the condyles are resting on the horizontal surface. The bone you see automatically or takes on an slightly oblique curvature or a slightly oblique disposition. This here is the normal anatomical position. Because I can see that this is the greater trochanter. The greater trochanter always points to the side to which the bone belongs. This greater trochanter is pointing to my right and therefore this is femur of the right side. So now I am not going to hold this bone in any other hand. If it's the right side bone, I can't hold it in my left hand. I can't. I must hold the bone in my right hand. Okay, that is one of the basic rules of studying anatomy. Hold the bone in the hand to which the bone belongs. Is that clear? So head superiorly, condyle inferiorly, greater trochanter laterally, pointing to the side to which it belongs. Convexity anteriorly, linea aspera posteriorly. This is femur of the right side. If you've got this, let's come back to the screen and now finally begin a detailed study of the femur. Okay, come. You must keep, I'm not going to hold the bone while teaching all the time, but you're going to be holding the bone at all times. There will be no getting away from femur today. Keep holding the bone in its normal anatomical position, not like this, the way I held it. You hold it like it is supposed to be in your body. Got it? Come back to the screen now. So here you can see the basic features which we studied. You've got all this. Now how to hold the bone. Like I said, hold the bone in the hand to which it belongs. I'm going to repeat this just once more. Rest both the condyles on a horizontal surface. This is the normal anatomical position of bone. Just a little additional information that may help you someday There is one more way of holding the femur. There is one more way of holding the femur. Suspend it with your index finger. It's very difficult. It's very difficult. I am telling you it's very difficult. But there are some examiners who may expect this from you. They may expect you to suspend the femur from your index finger. My suggestion is don't do it. The femur will fall and the whole purpose of holding the bone will be lost, because now the femur is definitely not on the ground, it's not in any anatomical position. So don't try to hold the femur with suspending it from your index finger. However, if you are asked to do so, you can attempt it. Okay? Come. Now, you observe that when you put the femur on the horizontal surface, femur tends to tilt. Come, look at the screen to understand. Can you see that both the femurs are not parallel? They are oblique. The lower ends are closer together than the upper ends, right? So now this is how femur is naturally placed. It comes naturally in this position. So if you are holding the femur by the shaft, you will be holding it wrong, because you would land up holding it straight. It's not straight in the body, it's oblique in the body. Okay? Henceforth, you will be holding the bone in your hand for the rest of the lecture. Now let's come to a little detailed study. So I'm going to divide the femur into an upper end, a lower end and a shaft like I taught you earlier. Today we're going to focus only on the upper end. Let's get into the bone, slowly learning a little bit more about it. In lecture 2 we learn about the shaft and the lower end. Okay? So come to the upper end of bone. The upper end of femur has a head, a neck, 2 trochanters, greater and lesser. So now, let's take a look at these features in the bone itself. Come. So now let's take a look at the bone again. Understand a little bit more about the details of the upper end. So this here is the head. This here is the neck. This whole thing is the neck of femur. This here is the greater trochanter. This here is the lesser trochanter. Head, neck, greater trochanter, lesser trochanter all form the upper end of femur. Now here I want you to note a few things before we go further. The head, as you can see, is covered by a very smooth articular surface. But if you run your hand on it, at the very tip, you find there is a depression. Did you see the depression here? This depression is called as the fovea. What is it called? It's called as the fovea. Okay. Come back to the neck. As you can see, the neck has an upper end, or it has an upper border. It has a lower border. Upper border going to the greater trochanter, lower border going to the lesser trochanter. Connecting the greater and the lesser trochanter anteriorly, if you look carefully, can you see that there is a clear line? Intertrochanteric line. Very nice, simple name. Intertrochanteric line anteriorly connects the greater and the lesser trochanter. Now I'm going to turn the bone around. Greater trochanter and the lesser trochanter are connected by a thick ridge. It's not a line, it's a ridge. This is the intertrochanteric crest. Anteriorly intertrochanteric line, posteriorly intertrochanteric crest, showing a little thickening here called as the quadrate tubercle. What is it called? Quadrate tubercle. These are the basic features of the upper end of the bone. We will discuss them more, but you need to familiarize yourself with features on the bone. I want you to focus on the surface of the neck. Be very careful. This is a very, very important point I am making. Focus on the surface of the neck. Can you see that there are fine longitudinal lines running towards the head of femur? Ridges. These are retinacular ridges. What are retinacular ridges? What is its function? And why is it so significant? We will be discussing it. But note all these features. Once you're done with the noting, let's come back to the screen and discuss all this. Okay? Come. So now, here you're looking at the upper end of femur, the head. Like I told you, the head is more than half of a sphere. Okay, it's not only half of a sphere, it's little more than that. It's directed forwards and medially, upward, forwards and medially. Okay, now please wait, I'm going to show you the articulation. Ma'am, they are not articulating. What happened? Why is this one not articulating with this one? What is wrong? Can you look at the two bones and tell me what is wrong? Yes, something is very drastically wrong. This is the left side hip bone and this is the right side femur. Now that's a point we need to make. When you're asked to articulate bones, it's your job to make sure that you're articulating the same sided two bones. You have no business holding the bone like this with the hip bone facing posteriorly and articulating them. It's your job to make sure that you're picking up the bones of the same side. You got the point I made? Okay. So now let me pick up the correct sided bone. So now yes, this is the right side hip bone. This is the right side femur. I articulate them. Okay. And you can see how the head of femur fits into the acetabulum, forming the hip joint. Okay. Now, so the articulation was just seen by you. The whole surface of head of femur is covered by an articular cartilage. Always remember, articular cartilage, a type of hyaline cartilage, is covering bony ends in such a way that it increases whatever is the curvature. If the curvature is a concavity, the articular cartilage will be thin in the center, thicker at the periphery, increasing the concavity. If the bony surface it is covering is a convexity, then it's thick in the center, thin at the periphery, increasing the convexity. That's the job of one of the jobs of articular cartilage. So you can see here this head of femur is covered by this articular cartilage, and in the center I showed you a little depression. The depression is called as pit or fovea. It's amazing that there is a ligament that passes inside the hip joint and gets attached to this pit or the fovea. This ligament is called as the ligament of head of femur. Very nice name, isn't it? But what is the purpose of this? Is it holding the acetabulum to the femur? Not at all. It's a very lax ligament. But it is carrying within it blood supply. And that blood supply which passes through the ligament of femur goes and supplies the head of femur. And that is very, very crucial. Very, very crucial. How, why, we'll come to it soon. Okay? But remember, the head of femur shows a depression called the pit or the fovea. To the pit is attached ligament of femur. Through the ligament of femur, blood supply from two arteries. Can you name them? Medial circumflex femoral artery and a branch of obturator artery come and supply the head of femur. Please note this, we will discuss it later. Okay, so now we come to the neck. This is the neck of femur, which is about 5 cm in length, connecting the head to the shaft. Can you see that it's creating an angle? It's creating an angle between the head and the shaft. Okay, so here's the head and the neck, and this is the angle with the shaft. So this angle between the neck of femur and the shaft of femur is about 125 degrees in the male. But it's lesser in the female. That means it's less than 125. Can you guess why? Why would the neck of femur, the angle at the neck of femur, be lesser in female and more in the males? That's because the females have wider pelvis. So the pelvis is quite wide. So the femur has to have that much more angulation to come medially. So the angle between the neck and the length of femur becomes more acute in the females. So the angle between the neck and the shaft of femur, 125 in the males and lesser in the females. Point clear? Ma'am, why is there an angle? Have you thought about it? Have you thought why there is an angle between the neck of femur and the shaft of femur? Imagine that there was no angle and the two femora were directly going and articulating with the acetabulum. The thighs would keep on brushing against each other while walking. Because of this angle, you're getting a very good clearance between the two legs so that you can walk comfortably. Otherwise, your two thighs would be brushing against each other. So, body is an amazingly logical machine. We must enjoy and appreciate the logic with which it has been created. Every tiny little thing you will see has a purpose to it. Enjoy it, appreciate the intelligence of Mother Nature. Come. So, the neck of femur has got an anterior surface. Remember I showed you retinacular fibers on it? So this is the anterior surface, this is the posterior surface. This is the upper border which you can see connects the head to the greater trochanter. This is the lower border which connects the head to the lesser trochanter. Simple, very easy. Okay? Right. So on the anterior surface, you can see these ridges I showed you. These are ridges for retinacular fibers. What are retinacular fibers? Please note it in your notebook that we are coming to this. Okay? One little exercise I can tell you to make you remember. Take your hand, twist your fingers inwards like this. Twist your fingers inwards like this. Just keep it there for a minute. We are going to come back to this. Okay? I'll tell you what it means. Just remember we did this. Right. So the anterior surface shows intertrochanteric line here. Posterior surface shows intertrochanteric crest. Okay. So now I want you to stand straight. I want you to look down. Okay. So that your shoe is coming out like it is on the screen. You should understand that the angle between the head and neck of femur and the rest and the line drawn through the condyles, there is an angle there. Take a look at the screen to understand. This is the axis of head and neck. This is the axis through the condyles, medial and lateral condyles. You find that there is a clear 15-degree angle between them. Almost as if you look at it carefully, my two condyles are in a horizontal plane. Okay? But the head and the neck of femur almost appear to be twisted. They appear to be, somebody has twisted them a little bit. This angle between the head and neck of femur and the condyles is called as angle of femoral torsion. What is it called? Angle of femoral torsion. So that the head and neck of femur is directed more forwards than the rest of the femur. Right, come back to the screen now. So 15-degree difference. So we'll now talk about the trochanters, but before we go on to talking about trochanters, let's quickly ask ourselves, what did we learn? We learned about the head of femur. We learned that it's more than half of a sphere, articulates with the acetabulum to form the hip joint. Covered by articular cartilage, has a depression in it called fovea, to which we have attached your favorite ligament, the ligament of femur, through which the head of femur gets blood supply. Conceptual clarity. Okay? Then we understood that the head is attached to the shaft with the help of the neck, and there is a neck shaft angle created which helps to swing the femur away from the median axis of the body. We learned that neck has an anterior surface showing ridges. It has a posterior surface. Okay? Now we come to the greater and lesser trochanters. Okay? Come. So this is showing you the greater trochanter here. And this second view is a lateral view. You're looking at femur from the side. Okay? On the femur from the side, come to the greater trochanter and see how anteriorly it gives attachment to gluteus minimus and laterally it gives attachment to gluteus medius with the help of an oblique ridge. Can you find an oblique ridge on the femur that you have? I'll show it to you on mine in the next few minutes. Let's quickly study this a little bit more. This area is the upper end of greater trochanter. Note the upper end of greater trochanter, which gives attachment to piriformis muscle. And then on the medial surface, there is the attachment of obturator internus and the two gemelli. Remember tricipital tendon? The tricipital tendon is made up of tendon of obturator internus and the two gemelli above and below it, right? So that tricipital tendon comes and gets attached over here. And in a little depression below it, the depression is called trochanteric fossa, is the attachment of obturator externus. All this is what you should know about greater trochanter, okay? Come now and I'll show you a little bit about the greater trochanter. Bring on your bone and let's study on the bone. So now let's focus on the greater trochanter here. This is the tip of greater trochanter. And here on the outside, if you look carefully, you can see here on the outside, you can see a clear oblique ridge. Can you see the ridge, students? It is here that your gluteus medius is attached. Turn it around and come to the anterior surface. Here is your attachment of gluteus minimus. In between the two, in the body when you are dissecting, you will find a bursa there. If you are a good dissector, you may find it. Attached to the tip of greater trochanter is the piriformis. Now just do one thing, run your finger below it. Your finger disappears in a fossa. Did it disappear in a fossa? Mine is clearly going into this fossa. Can you see it here? This is the trochanteric fossa for the insertion of obturator externus. Okay, so this is the tip of greater trochanter, piriformis. Medial surface, the tricipital tendon, obturator internus, superior inferior gemelli, and in the depression below it, the trochanteric fossa for the insertion of obturator externus. On the outer surface of greater trochanter, you will find an oblique line for the gluteus medius and an anterior surface for gluteus minimus. If you've got this much, then that's greater trochanter, and let's now focus on the lesser trochanter. Turn the bone around and look at it here. This here is your lesser trochanter, medially placed, okay? It's at the lower end of the intertrochanteric line and continues, do this with me, okay? Intertrochanteric line, lesser trochanter, and you find that your finger continues down along a line. This line is called as the spiral line. Greater trochanter, let's do this again. Greater trochanter, intertrochanteric line, lesser trochanter, turn it and continue down, spiral line. Okay, all these are things that you should be knowing. Okay, let's do this on the bone and then let's discuss it. One last time. Greater trochanter, intertrochanteric line, lesser trochanter, spiral line. Some books also mention this whole line as the spiral line. Just remember that such a line exists. Come, let's come back to the screen and begin our discussion. Come. So we now go to the lesser trochanter. Okay, here's the lesser trochanter. With this, I think we should ask ourselves a question. What is a trochanter? See, when you're being formed, the muscle is attached to the bone and there is no trochanter. But as the muscle contracts, it pulls on the bone. As it pulls on the bone, slowly the bone develops into large projections called trochanters compared to smaller projections called tubercles. Okay, so here in the femur, we see large projections and hence they are called as trochanters. Sometimes these are things which are basics, you must know them. So why are they formed? Because of pull of the muscle. Okay. So what is attached to lesser trochanter? You saw so many muscles attached to greater trochanter. So to the lesser, this is a bit of theory. You are expected to pause and read. I am not discussing it, but it's information for you. So now here's your lesser trochanter seen anteriorly. Here's your lesser trochanter seen posteriorly. You can see the attachment of psoas major to the very tip of lesser trochanter, and the line that I talked about that continues downwards is for the insertion of iliacus muscle. Now I don't know how much of gross anatomy you students have done, but you should know that the psoas major and the iliacus are together called as iliopsoas, and this iliopsoas tendon basically gets attached to the lesser trochanter and the line beyond it. Behind this line, you find another insertion which is of the pectineus muscle, which we will be discussing later. So what did we learn about lesser trochanter? Present on the medial side, gives attachment to psoas major. A little below it gives attachment to iliacus. Psoas major and iliacus are often considered as a common tendinous attachment referred to as iliopsoas tendon. Okay, right. So what is spiral line? I just showed it to you. Okay. So at the junction of upper end and the shaft, you find two lines. One is the intertrochanteric line and other is the intertrochanteric crest. I've shown it to you on the bone. Let's see it here once. So this here is the intertrochanteric line extending from greater trochanter to the lesser trochanter anteriorly. This here is the intertrochanteric crest extending from the greater trochanter to lesser trochanter posteriorly. What is the difference? Line is thin. Crest is thick, ridge. Crest is a thick ridge. So that's the difference. So let's learn what is attached to intertrochanteric line. There's a very nice way of remembering this. Two muscles, two ligaments. What are the two ligaments? Let's discuss those first. The two ligaments are capsule of hip joint and iliofemoral and pubofemoral ligaments. Both are very important ligaments, part of hip joint. So, two ligaments, done. Now two muscles, vastus lateralis, vastus medialis. Okay, so easy to remember, intertrochanteric line, two ligaments, two muscles. Two ligaments are capsule of hip joint and pubofemoral and iliofemoral ligaments. Two muscles are vastus medialis, vastus lateralis. Easy? Fine. We go to intertrochanteric crest here, and just behind the crest I had shown you there is a thickening called as tubercle. Which tubercle? Quadrate tubercle. Which tubercle? Quadrate tubercle. You can see it here. Attached to the quadrate tubercle is a muscle called quadratus femoris. There is a muscle called quadratus femoris. So, you've just learnt about intertrochanteric line and intertrochanteric crest. But before we end this class, let's quickly talk about this. Remember I told you something like this. So what happens is, there is a capsule of the hip joint. Proximally the capsule is attached to acetabulum and distally it's attached to the neck of femur. Okay, where is it attached? Come, let's take a look. Anteriorly it gets attached almost on the intertrochanteric line. I showed you how the intertrochanteric line gives attachment to capsule of hip joint. But posteriorly it goes 1 centimeter medial to the intertrochanteric crest. These two lines on the screen represent attachment of capsule of hip joint. Then you must be wondering, so what is so important about it? It's important because the anterior surface shows ridges. We come to the same ridges that we spoke about. I'll tell you what happens. To these ridges are attached retinacular fibers of the capsule. What are retinacular fibers? One last time, pick up the femur. So when the capsule comes and gets attached on the femur, do the same exercise I showed you. Bend your fingers inwards. What happens is, the capsular fibers, after reaching femur, bend inwards. They reach the femur and they turn inwards. The inner fibers are called as retinacular fibers. I'm going to show you an amazing image which will convince you. Come. So here, take a look at this green belt on the screen, this green belt. This is the capsule. And the fibers of capsule after reaching the femur, please do this exercise with me. The tip of your fingers are going on the acetabulum, they are coming back on the femur and then they are turning inwards along the neck. They are coming from the acetabulum, they are coming to the neck of femur and then they are turning inwards. These in-turning fibers are called retinacular fibers. Why do they turn? Now come to take a look at these blood vessels. Can you see that? These are retinacular arteries, which are branches of lateral and medial circumflex arteries, branches of profunda femoris artery. And as they reach the capsule, they pass below the capsule, running along the neck of femur. And can you see those pretty small little arteries that have gone on to supply the head of femur? Take a look, focus, come on. These little arteries are so crucial. so crucial. They are going on to supply the head of femur. Then you will think, ma'am, somebody has already supplied it through the ligament of femur. So the head of femur is getting supply from one end, from the ligament of femur, from the lower end by these retinacular arteries. Now what is the significance? I'll show it you. Why do we talk about it? What happened? Did you see what happened? You saw that there was a fracture neck femur happening here. There is a fracture neck femur happening here. When the neck of femur gets fractured, can you see that the line of fracture is passing through the retinacular arteries? Now, if you are not aware of this, okay, this fracture is not going to heal. If the head of femur is not getting blood supply through the retinacular fibers, this fracture is never going to heal, and you will keep on attempting to heal the fracture. It will not heal because retinacular arteries are cut. And that is the significance of knowing about retinacular fibers and retinacular arteries. Okay. So in case of intracapsular fracture of neck of femur, the fibers, retinacular fibers can be torn, tearing out the retinacular arteries, causing the head of femur not to get blood supply, leading to non-union of a fracture. Have you understood? And that is why I have been stressing on this point to such an extent that so many times the fracture neck femur goes into non-union because of lack of blood supply, nothing else. The doctor's skill is not in question at all. It is the question that their blood vessels have been cut. Unless those are replaced, there is no way this fracture is healing. Right. So I've asked you quite a few questions. There is also I have attached a series of questions in the form of a Word document with this. Okay. So please go and solve all these questions. If you have doubts, please feel free to connect with me. Once you answer all this, then come to femur part 2 to study the rest of femur. You'll be surprised at how beautifully you will understand femur as a bone if you do the part 1 before you join in on part 2. Okay? Of course, all answers are always given in the notes section. In case you don't find an answer or you want to check your answer, feel free to go and check it in the notes section. I hope you enjoyed this class. I hope you learned well. I hope you learned the basic of holding the bone in its normal anatomical position in the hand of the side of the bone. And I hoped it helped you to learn the upper end well. I'll see you in femur part 2. Bye.